give you the... We're live.
Well, hi everybody. Good morning. I'm Dr. Greenwald, and I'm inviting everybody to my very first Facebook Live with Dr. Lori Greenwald. This is your opportunity to ask any questions about vein disease that you want. Feel free to type it, however it goes, and I'll be more than happy to answer any of your questions. First thing that I want to say is that we're finishing our summertime, sadly, and New England, we went from boiling hot to freezing cold right away. This is actually telling us that it's time to get ready for the fall, get all the kids off to school, college kids are gone, and now guess what? Now it's time to think about yourself. So, remember every single time you looked at your legs in the summertime and you saw those ugly spider veins or the large ropey varicose veins, you kept on saying, when the kids go to school, when the kids are out of school, when the kids are off at college, and years go by and you haven't taken care of yourself. This is one of the commonest things I see, especially for women. They come in after the kids are out of the house. So I'm going to tell you something. You don't have to wait that long anymore. Everything that we do to treat veins, whether it's cosmetic or medical, is all done in the office. There's essentially no downtime at all, and you don't have to keep putting it off. So all you have to do is give our office a call, 860-761-6666, and ask to have a consultation. I've always believed that knowledge is very important. You don't have to make a decision, but at least understand what's happening with you and what treatment options are available. Okay.
Very good. Dr. Greenwald, we're actually getting a lot of questions via Messenger right now. So I think we're going to go over to those. Let's see who we have. Okay, Dr. Greenwald, the first question is actually from Allison.
Okay. Hi, Allison. I hope you're listening.
Allison wants to know, could reoccurring charley horses be a vein issue?
Allison, that is a great question. So the reality is that charley horse is a generic term. It's sort of a layman's term for any type of cramping that can happen in your legs, usually in your calves. Charley horsing or cramping can absolutely be one of those subtle signs of broken veins inside your legs. They usually occur at night. They can be extremely painful and oftentimes will wake you up from your sleep. You need to get up and walk around. So that is a classic, subtle sign that you might have something going on with your veins in your legs. And the only way to really know is to have a ultrasound looking at the veins inside your legs so we can decide if they're functioning properly or not. I hope that answers your question.
So, Dr. Greenwald, people actually ignore those symptoms sometimes, don't they?
Yes, they always ignore symptoms like charley horse or tired legs. One of the things that I've done in our patient questionnaire is put in not only the obvious questions, everybody knows if you have large veins or if the veins hurt you, but the subtle signs that you might have vein disease. All those questions I've put in our patient questionnaire. That gives you, the patient, the ability to think about, oh, wait a second, I do have restless legs, another subtle sign that you might actually really have broken veins in your legs.
Perfect, thank you. Dr. Greenwald, our next question is actually from Jennifer. She actually wants to know, is there something she can do to prevent spider veins? She's heard that wearing heels and crossing her legs may actually cause spider veins. Is that true?
Jennifer, one is and one isn't. So here's the thing. It is an old wives' tale that crossing your legs causes spider veins. That's not true at all. So go ahead, cross your legs as much as you want, but not in high heels, okay? That has been shown to change the angle of your foot. When you change the angle of your foot, you take the muscle in your calf and you prevent it from functioning normally. We call it the calf muscle pump. So when you do that, you are actually letting the blood in your veins pool. In other words, they can't move because that calf muscle isn't pumping. And therefore, it is one of the things that can lead to broken veins. Spider veins in general, unfortunately, are hereditary and related to pregnancy and hormones. So there's certain things we can do, but you can't change your genetics.
Interesting, thank you. All right, we have another question. This one is from Gail. Gail wants to know, how can she tell if swelling in her legs could be tied to vein issues?
Gail, that's another excellent question. Swelling, again, is considered a subtle sign of vein disease. I'm not going to bore you with how that happens, but if you do have swelling either in one leg or both legs, even though you may not have any sign of varicose or spider veins, the inside veins could still be broken. And again, you would need to have an ultrasound of the veins in your legs in order to determine if they're functioning properly. So let me just take 1 minute and let's just talk about the ultrasound, which I've mentioned several times. An ultrasound, which we pretty much all know what that is, it doesn't hurt, it's not harmful at all, and the same way that we might use an ultrasound to look at the fetus, the baby, we use the same exact technology to look at the veins in your legs. However, there's two parts to that ultrasound. One, to see if the veins themselves are open and no blood clots, which is very important. And the second part of the ultrasound is looking at how the veins actually work. So it's real time that we can see the blood flowing on our ultrasound. Key point here. The way the ultrasound is performed is the difference between an accurate result and a false result. In order to perform the ultrasound properly, you need to have your ultrasound done in a vascular laboratory that's accredited by the Intersocietal Vascular Committee, and the technologist who's performing the test has to have years of experience specifically in this test and be a registered vascular technologist, one of the hardest tests to pass. Most do not pass it on their first or even second or third try. Now, going back 1 second to the way this test is done, it is completely dependent on the vascular technologist performing the exam. Therefore, if the exam is done lying down, if the exam is done with you standing for a long period of time, then those tests will not give correct results. Key, pay attention, make sure that the ultrasound is being done correctly. And if you have more questions about that, we'd be more than happy to answer for you.
And Dr. Greenwald, you've been with your RVT technician for quite some time. How long have you guys been together?
Heading towards 12 years. My technologist, her name is Jackie, she started with me only like 3 years after I opened up my vein center. And the thing that's so important is that we got our knowledge and experience essentially at the same time. So we started in the very beginning of the minimally invasive vein treatments, all geared based on ultrasound. So when Jackie came to work with me, she had been the head of one of the vascular laboratories at a large hospital in Philadelphia. She came here, and in the beginning, there were very few places that did exclusively vein treatment, and there was a large learning curve for her and for me. And we've passed that curve a decade ago, and we work extremely well together, and she's an expert at what she does.
Fantastic. Two experts in the same field. We actually have a live question, somebody who's not shy. This is from Donnie. What problems can occur if varicose and or spider veins are left untreated?
Donnie, that's an excellent question. So, since Donnie is a man, I would like to say to everyone listening, and you can also talk to your male friends, that men also get spider veins and varicose veins. Not as much as women do, but they definitely get it, mainly from genetics. Now, if you do not treat, let's start with spider veins, nothing is going to happen. The worst symptom that you could get from spider veins is a localized area of burning or a little dull ache. Sometimes people say numbness. But it truly is a cosmetic problem. Spider veins do not grow into varicose veins, and they do not cause any problem with blood flow in your legs. So if you have spider veins and you don't like them, then you can have them treated, but nothing will happen to you medically if you leave them alone. On the other hand, when we're talking about varicose veins, and varicose veins, for those people who don't know, are the large, bulgy veins. They're kind of blue and they could be ropey. Those veins can go on to cause symptoms that are severe enough to affect your daily routine. In other words, your legs can become very tired, very fatigued, and you might find that it's pretty hard for you to stay in the kitchen and do what you have to do. I have a great example. A woman came to me. She was young. She was in her 30s. She had 3 children under the age of 5. Her varicose veins hurt her so much that she couldn't get through the morning with her kids unless she elevated her legs. So that's a little bit of an extreme, but to be honest, very, very common, especially affects people who are young and healthy, either home taking care of their kids or out standing teaching nurses. Some other things that can happen are much less common, but if the veins are so bad, they can begin to cause damage to your skin and the lower part of your leg, and worst case, they can go on to cause an ulcer or a sore that doesn't heal. That, again, is at the lower part of your legs. So varicose veins do have health ramifications and also quality of life issues. Very important for all of you who are out doing what you have to do and you don't have any time to elevate your legs in the middle of the day. Thank you, Donnie. That was a great question.
Thanks, Donnie. And just, yes, men, women, you see everybody, Dr. Greenwald, correct?
Yes, I do. As a matter of fact, my youngest patient was 14, and that would be genetic. So girls or boys can have very painful varicose veins. As a matter of fact, when you're a teenager, I have a girl who was unable to run track because her veins throbbed and hurt so much that she couldn't run track anymore. And after taking care of her veins, all in the office, I now have a, 12-year follow-up on her, and she's still running out of college, and she's had a great time with her legs. Next, women of any age, definitely, and men. So the majority of men will start noticing it in their 20s or 30s, and they can thank their mom or thank their dad. But as we get older, the number of people who get varicose veins increases with age, sadly. So your hair gets thin, your skin gets thin. Well, guess what? The vein walls also get thin. So if you look at the population of people in their 60s and 70s, it's a much higher percentage than those men in their 30s, 40s, and 50s.
Fantastic. We're going to go back to Messenger. We have a question from Rebecca. Rebecca says, works in retail and she's on her feet all day. She wants to know if wearing compression hose now would help prevent any vein issues in her future.
That's an excellent question, Rebecca. So for those people who do stand all day, there are several things that you can do to slow down the process. You maybe cannot actually stop it. So if you have the predisposition, the genetic predisposition, you're going to get some type of veins. But by wearing compression hose, you will keep those veins flowing, just like we talked about earlier, the calf muscle pump. You'll keep those veins flowing and decrease the likelihood of getting broken veins. And number 2, no high heels. Number 3, you're in retail. Make sure you don't stand in one place for a long time. You want to either take some little walks around your counter if you can, but if you can't, you want to activate the calf muscle pump. How do we do that? We stand up and we step on the gas. So what you want to do is you go toe up, down, up, down, up, down, 10 times every hour. You're pushing that blood out of your legs. It prevents the pooling, and that's an excellent mechanism to use when you're standing for long periods of time. Keeps your veins nice and strong and healthy.
Okay, we're going to say hi to Sadie. Sadie, you know, we're definitely trying to give back and inform people. Dr. Greenwald, Sadie says, thank you so much for your knowledge on this topic. She's enjoying the live feed. It's really great. People, you know, can ask questions. They don't have to wait for this office visit to get just the knowledge. And Sadie thanks you greatly.
Well, thank you, Sadie. You're so welcome. I would like to thank everybody for...
Oh, wait, Dr. Greenwald, we got another question. I'm sorry, I don't want to cut you off. We have a question from Tina. She just came through on Messenger. You kind of answered it. She wants to know if there's a certain age when you're more likely to suffer from varicose veins or maybe notice them more.
Right. Okay, Tina, that's, again, an excellent question. The commonest time for people to notice or get varicose veins is in women during childbearing years. Sorry, guys, yet another problem to be a woman, but also a blessing. So every time we become pregnant, the hormones in your body, the baby itself, and the fact that the blood volume has to increase, all those three things will cause the veins to stretch and become broken. Now, you're talking about women mainly in their 30s and 40s. Those are the commonest group of people that will get varicose veins.
Perfect. And it looks like we have one more question from Kayla. Kayla wants to know, when going through treatment, Dr. Greenwald, I know you do varicose veins and spider veins.
Yep.
So let's quickly talk about both. When going through treatment, how soon do you see those results?
Great question. So, those veins didn't pop up overnight, and therefore it did take years to develop. It won't take years for them to go away. However, there is a process that you have to go through in order to take care of getting rid of your veins. So depending upon the extent of your broken veins, the extent of the spider veins, it may take months and sometimes a year to see the final result. Usually you start seeing the results cosmetically within several months, and medically you can actually start to have your legs feel better within a day or two of your treatment. I kid you not. That's the truth.
So after you get the treatment. So, you know, there is a process, we know, in regards to insurance companies and things like that. You know, we love dealing with them. But after the treatment, so if you perform a radio frequency ablation on a patient who's suffered from these painful legs, let's say she's in your office Monday morning for her procedure, when should she start feeling relief?
The majority of people will actually start feeling relief by the next day.
Amazing.
It is amazing, and oftentimes when people come in to the office for their first checkup, they're like, oh my God, I had no idea what I was living with on a day-to-day basis. I thought I was just getting old. And all of a sudden, my legs are lighter. I feel like I have so much energy just within a couple of days.
Amazing. We actually have another live question from somebody who's not shy. We have Ellen here. Ellen wants to know, do varicose veins skip generations?
No.
No. Oh, no.
No. So the genetics for varicose veins is not well known. We do know that if you take a mom and a dad and they have blue eyes, we can calculate the percentage that their children will have blue eyes. That's classic Mendelian genetics. But when it comes to varicose veins, we still have a lot to learn about exactly what happens and how that gene or genes is passed down. So the only thing I can say to you, Ellen, is if your mom has them or your dad or both, then you definitely are at an increased risk of developing varicose veins. The worst is mom and dad together, then you have a pretty good chance that you're going to get them.
Oh, that's not good.
Not good. Not good.
Genetics will get us every time.
Absolutely.
Dr. Greenwald, you've answered a ton of questions today, and I know you have to get back to your patients. Ellen actually says her beloved mother had extremely bad varicose veins, but she has none yet. So, Ellen, we hope it stays that way.
Right. I mean, Ellen, to be honest with you, it does depend upon your age and whether you've had childbirth. So, if you're young and have not had children yet, sadly, you are probably going to get some veins. But if you've managed to get through childbirth and have not had any varicose or spider veins, I would say you're probably good to go.
All right, Ellen, we are keeping our fingers crossed.
Absolutely.
Dr. Greenwald, this live event has been so great. Why don't you tell the viewers and the community what you're doing on September 14th?
Thank you. So I have decided to invite interested people to come for a dinner and discussion and discovery. We're going to be talking about the subtle signs of venous disease. Now, this event is going to happen on September 14th. It's going to be at
5:30.
5:30, thank you. I always need my little cue there. It's going to happen at 5:30, and it's going to be at the Jewish Community Center in West Hartford. Just newly renovated, beautiful space. So we're going to have dinner for everybody. We're going to ask you to give us a call at our office, 860-761-6666. We do ask that you register so we know how many people are coming. Feel free to bring a friend. It's going to be a great night. I have to tell you, I opened up my vein center in 2003. At that time, there was virtually no one, a couple of people here and there in the area, limiting their practice exclusively to veins. Back then, I gave talks all the time. My talks were very well attended. I answered a ton of questions, very educational, and a lot of fun, actually. Then, for many years, I stopped because I thought that it was a little bit inundated and give it a break. But believe it or not, people have been asking me again and again, when are you going to give a talk? When are you going to give a talk? So remember, September 14th, it's going to be my first talk in years, which means I'm going to be writing a brand new talk September 14th at 5:30. Give our office a call to register, 860-761-6666. You'll have a great night. I'm going to introduce my entire staff to everybody so you can put a face with the voice on the phone. You can meet my practitioners. You'll meet my wonderful estheticians from my med spa as well. And we really look forward to you joining us that night. Thank you, everybody. Thanks for joining us. This is the first of many Facebook Lives with Dr. Greenwald. You have a great day. Take care.